Welcome to this video documentary produced by Theophile and Niyitegeka. It is about the impact of mosquito nets in fighting against malaria as a disease which has now become rampant in some districts of Rwanda. Malaria remains a killer disease despite long-term costly control efforts. The government of Rwanda has implemented the countrywide anti-malaria interventions over more than a decade, including national insecticide-treated nets. It is common knowledge that stagnant water present in cesspools and ditches provide breeding ground for mosquitoes. Malaria is one of the leading causes of child deaths in Africa. It is transmitted from person to person by infected mosquitoes. It involves flu-like symptoms including fever. As efforts to fight malaria, insecticide-treated net was fabricated to save lives and reduce its negative consequences to communities. The vector for this disease was not identified until 1880, when Charles Louis Alphonse Leveran identified the mosquitoes as a vector for malaria. According to health experts, insecticide-treated nets are estimated to be twice as effective as untreated nets, and they offer greater than 70% protection compared with no net. The Rwandan government has taken various measures to eradicate the rate of malaria. However, the disease is still rampant. Statistics from the Ministry of Health indicate that from 2013 to 2015, malaria patients increased threefold. Though the country held mobilizations, differences from communities lacking rapidity in the adoption of new measures among other cultural beliefs and perceptions influenced the eradication of malaria in Rwanda. Some localities still live nearby bushes in some parts of Kigali and elsewhere in the country. Since mosquito nets were introduced in Rwanda, citizens hail mosquito nets for all in fighting against malaria, but express lamentations over their inadequacy. They also express worries over mosquito nets they once received, which have become breeding ground for parasitic insects, and decry them over lacking standards. I don't know what hampered the distribution of mosquito nets. It has been long without receiving mosquito nets. I think it's almost 1 year without receiving mosquito nets. Even existing mosquito nets we obtained previously have fallen in misuse, and parasitic insects are growing through such old nets. Else, mosquitoes can penetrate easily in those old mosquito nets. The government should try by all means to avail mosquito nets to citizens regularly, since malaria became aggravated after the shortage of mosquito nets. Other citizens hail mosquito net usage, witnessing the malaria prevention experience. Mosquito nets played a vital role since in the past malaria was terrifying among families. After the introduction of mosquito nets, the gravity of malaria was lessened. For instance, I suffered from malaria once. After the arrival of mosquito nets, it was the first time coming to Kigali. Now, 2 years pass without malaria contamination. I can conclude that a mosquito net is very important when it is used effectively. Mobilization to combat malaria is done. However, strengthened measures should be implemented to reach and convince ordinary citizens in remote areas, since they sometimes fail to adopt policies. other than concentrating on mobilizing only citizens from urban areas. As I think, some people reject to use mosquito nets, saying they bring excess heat and warmth as they sleep overnight. However, we should understand that a medicament is always better. If you want to get cured, of course, you need to take medicaments. When you know mosquito nets bring excess heat, you should not sleep under warm blankets. Another young man ignores the use of mosquito nets. This adds to traditional beliefs that whatever you do, a person can't escape the destiny. It is said that a mosquito net can fight against malaria, but I don't use it because whenever I get contaminated with malaria at midday in daylight, while we are supposed to sleep under mosquito nets at night. If I remember well, I suffered from malaria like 7 times, and I think whatever you do, you can't escape the death. Sebera Welaus is another young man from Gachenye. He attested that he rarely slept under mosquito nets, but he is shocked to see people misusing mosquito nets in poultry. I have not suffered from malaria. It would be a liar to attribute it to the usage of mosquito nets, since I scarcely used mosquito nets as I slept overnight. However, I recognize the role of mosquito nets in fighting against malaria, and I've been surprised and shocked to see where mosquito nets are misused. Some people use them in poultry, breeding chickens abroad or residences, and are misused in other areas where they are used covering kitchen backyards, lest birds eat their fruits. So I think such people should get severe punishment. Nyandwi Jean-Pierre, citizen of Kigali, finds that adopting government policies would contribute a lot to fighting malaria. I call upon Rwandans to sleep under mosquito nets and avoid bushes surrounding their residences and remove ditches containing untidy water. I think such practices will contribute a lot to eradicating malaria. Thoughts of Mupenzija are a little bit similar with Nyandwi Jean-Pierre. Mupenzi thinks people should use mosquito nets effectively and keep away from marshland waters. To fight against malaria, we must sleep under mosquito nets and keep away from marshland waters. However, even though we can implement all these practices, it is not easy to find a mosquito net. Niyitegeka Refikat expresses his concerns and lamentations over mosquito nets he has recently received, which is of substandard, while mosquitoes can stand on it easily and penetrate inside as he comes to sleep. In the past, we would receive blue mosquito nets which were original. However, now introduced nets are useless as mosquitoes stand on them freely and descend to bite a person when he or she enters the bed. This is different from mosquito nets in the past, as no mosquito would approach them. I wish the introduction of quality standard mosquito nets. The government of Rwanda has implemented various measures to fight against malaria. Citizens are advised to cut bushes in which mosquitoes hide, clear ditches, and keep their homes clean. The Minister of Health, Agnes Binagwaho, has been joining citizens in local communities, reminding them about protecting lives against malaria. Previously, in February 2016, the Minister of Health Agnes Binagwaho joined the Burera residents in a community work organized as a part of anti-malaria campaign. Burera is among the districts of the country mostly affected by malaria. The Minister of Health Binagwaho urged the Rwandans to effectively apply mosquito nets.
First of all, I congratulate Butera resident for having attended this community work of launching anti-malaria campaign and encouraging citizens to embrace hygiene. We know how malaria is contaminated. We must adopt measures of killing mosquitoes spreading malaria through embracing hygiene in our communities, clearing brushes and dishes. Rwanda has made a progress in health sector, but poor hygiene decelerate our steps, which is also among causes of malaria increase. I request you to adopt government policy embracing hygiene and anti-malaria control strategies for a bright future.
The Ministry of Health had planned to eradicate malaria before the end of the year 2015, but the plan has not been successful since the disease is still rampant across different parts of the country. The failure is attributed to climate change and the ineffective implementation of malaria preventive measures. Talking on readiness of Rwanda in the drive of fighting against malaria, the head of Malaria and other parasitic disease division at Rwanda Biomedical Center, Corinne Karema, said that more efforts are being put in place.
First of all, for this year, the government of Rwanda, with support of partners, is planning to procure 6 million of mosquito nets. So we are waiting to receive by June 1 million mosquito nets. And then in July we are going to receive 2.5 million mosquito nets, up to September where we'll be able to receive 6 million of mosquito nets. And those mosquito nets will be of course distributing in the district based on the priority in terms of malaria burden district.
She said that Rwanda is currently ready to address mosquito net issue, which citizens say are few and substandard.
Then through the procurement process, we ensure that there is a high quality of mosquito net. So before the mosquito nets are being sent to Rwanda, we usually check on the certificate of the quality of standard of mosquito net. And then even when the mosquito nets reach the country, we usually do physical inspection and then send the sample also outside to WHO approved laboratory to see if the quality of mosquito nets are okay. Now the issue of substandard mosquito nets, which was seen in previously in Rwanda, the problem was the mosquito net when they reached the country, they had all the certificate, but when they went to the community, the insecticide content was not enough 3 months after, 5 months after, while according to WHO, the insecticide content needs to be at least 80% even after 2-3 years. And this is an issue. And then this is an issue which was also seen in other countries. And that's why the company producing those specific mosquito nets was removed on the list of approved WHO mosquito nets. And since when the 1 million mosquito nets will come, we are also going to send to 10 districts following the number of malaria cases, up to when we receive the total, and then which will be distributed countrywide. So
malaria is among killer diseases in Rwanda. The country registered an increase in malaria cases from 514,173 in 2012 to 1,957,000 in 2015. However, since the year 2014 to 2015, there was a slight decline of malaria deaths from 499 to 424. The government targets at least one mosquito net per 2 people. A mosquito lives for between 21 and 28 days and is able to infect after every 2 days. It can fly up to 2 kilometers and 13 kilometers in an environment that favors it, which means spreading the disease is quick. Reinforcement of measures to control malaria would contribute a lot to saving lives of people at risk to achieve the objective of zero malaria deaths. This documentary was edited and produced by Theophile and Niyitegeka.